Hello, everybody, and welcome again to another episode of Dentistry Beyond the Numbers. My name is Dr. Mark Leichtung, and I am so grateful that you're back. Really grateful, as I said previously, how much support I've been given. The accolades, the reach outs, the shout outs have been inspiring. And here we go. We're going to do another great episode. And remember, the goal of this podcast is to solely educate the different aspects of dentistry that I've touched, I've been involved in, that I love and cherish and feel that I could help young dentists out there for now guide their careers to become seasoned, professional, high earners and feel that they've given to the profession and the profession is given to them. Without further ado, today's a great episode. You know, the last 7-8 episodes, we dove into the dental hamsa, the hand. We discussed the 5 major categories of dental procedures that I want doctors to really gravitate to. We called those doctors the super generalists. Those doctors are doctors that are near and dear to my heart. You know, they've accumulated great knowledge, great understanding of all aspects, occlusion, fit, function, form, all the above terms that we've learned in dental school. And now we've as a group, and I think we're going to be a very select group, and we'll get into some really exciting numbers, but they have really grown their careers to become excellent clinicians, super generalists. And let's face it, with that comes some really fantastic earning. And that's what we're looking to guide our doctors to, because we are gauged by how we come home and feel good about our work-life balance. Is our practice efficient? Without further ado, let's get into it, okay? So this episode, we talked about the procedures. We talked about gravitating towards being a super generalist. But I just got out of dental school. I just got out of my residency. I just landed my first job, and I'm not happy. I heard your podcast, Doc. I want to do that. What's the best way to do it? You know, I looked at my podcast, the last 7-8 episodes, and I realized I left you guys on an island. I need you guys to gravitate towards understanding how can I accumulate the knowledge, the confidence, and the ability to do the things we previously discussed. The clear aligners, the root canal therapy, the crown and bridge cosmetics, surgery, surgical extractions, bone grafting, and placing implants. That's our ultimate goal in being a super generalist. So today, we want to really start with some really excellent statistics that I've come across. And I feel it's excellent because it does guide what I'm trying to discuss in our podcast, and I think it'll be very awe-inspiring as we go forward. First of all, the increase of graduates over the last 3-4 years since 2022 has been 1.2%. 1.2% of dentists have entered, an increase of 1.2% have entered the workforce. It's kind of amazing if you think about all the doctors that are retiring, the dentists you know that are old and affirmed that might be passing on or just saying enough is enough, injuries, people that have made a lot of money want to retire, people that need to retire for other reasons. Only 1.2 increase leaves a large void for us young dentists coming out of our programs, out of our residencies, to really fill some of these great spots that will be in need. The second statistic is 35 to 40% of the students that are graduating today are moving on to a more advanced program, a residency, a fellowship, or a specialty. 40%. That leaves 60% that are going into academics, staying on for a family practice, going into private practice, getting a job in a DSO, which we're going to get into, but not going on to a more of an elaborate educational component to enhance their careers and the armamentarium that they're delivering their patients. The next is the big one. 64% of all dental students that are graduating today have at least $250,000 in debt. 39% have over $300,000 in debt. Now, that line makes it very difficult for us as young dentists to go to a bank and look to purchase a private practice like many people did many years ago, when rates may have been low, practice acquisitions may have been a percentage of gross, not a multiple of the profit of a practice. So they were cheaper to acquire, less expensive, meant maybe family and friends can help me. Maybe I get a loan from a bank that won't cripple my fact that I'm paying a debt. These are the things that go into it. So those are the things that directly influence where we're going in the future. Do we have a lot of debt? Do I need to go out and make a living to pay off that debt? Can I live with the debt? You know, one of the real attributes of an entrepreneur is understanding debt and living with it, sleeping well with it, and knowing that the businesses you run, the practices that we are gearing up for much success, and they will be able to handle any debt that we bring on, because as we grow and the debt may stay with us, we are making that debt minimal by increasing our revenue. So that is an incredible point. And I really do want you to understand that all these aspects dictate which direction a young dentist will take. The other aspect is, what are my options? What are the options of today's world? Is it only private practice? Today, we sit with the ability and the opportunity like we've never had in dentistry. We have a DSO, Dental Service Organization, a DPO, which has been around for about 5 years now and gaining much acclaim, probably the type of structure that we as dentists might gravitate to more, and we'll get into why. And third, of course, is the private practice. So let's go through them. A dental service organization is more of a large group. I look at a dental service organization where it's more specialty driven, meaning the dental group that's there, whether it be, for all our names of a Heartland or a Dental Care Alliance, these are large group practices that take in young dentists, have a program for those dentists to do bread and butter dentistry, produce what they're going to produce, but be very mindful. Molar root canals, extraction, bone grafting, implant placement, possibly clear aligners. They have specialists to do these procedures. And we're asking dentists in these dental service organizations to treatment plan and do all the bread and butter of dentistry, but refer all the more specialty work into the specialists. The dental service organizations usually rely on the dentist and their own ability to take the initiative to teach themselves or to find courses and to learn within the confines of the group the specialty or the more advanced dentistry that they're looking for. I find that's a little different to a dental partnership organization. A dental partnership organization is something that I am actually in right now. I sold a group of practices to Guardian Dentistry Partners. Guardian Dentistry Partners attracted me through their educational model. I'm learning that these partnership organizations look for the general dentist to not only be a partner eventually, but to be one of those super generalists. They believe, and I believe as well, and that's why if you heard my podcast, I do like this philosophy, is that they believe in something called the GROW model, or advancing the dentist to the procedures and the practice of their dreams. They believe, and they meaning the group practices that are more partnership driven, they believe that if you train a dentist to be excellent, to be proficient, to deliver the procedures that they like to do, they want to do, and they go home feeling great about it, they will increase their production by tenfold. You will have a doctor that goes to work and is producing $3,000 a day, come back and produce $20,000 in a year because they've learned how to do clear aligners, more efficient in surgical extractions and bone grafting, single tooth placement of implants, and root canal therapy. These are all things that we talked about during the last set of episodes in Dentistry Beyond the Numbers. And I truly believe that if you get into the right setting, your education, your malpractice, possibly your medical, they're all covered. This is a great avenue, a little different than DSOs, a little more, in my opinion, involved in the clinical aspect, although please, every group, every practice is different. I'm going by what I've experienced in the normal run of these groups. The third opportunity for us young dentists is the private practice. Pros and cons in a private practice. The pro is you don't deal with corporate dentistry. I hear that all the time. I don't want to deal with corporate dentistry. I'm not sure why. I'm not professing corporate dentistry, but if it's just that you don't want somebody telling you what to do, nobody is going to tell us, dentists, how to treat our patients. And if they do, that is borderline, I'm done, because I want nobody to tell us how to practice and how to treat our patients. So people that run to private practice for that reason may have an absolute reason, a good reason. They've had a bad experience. Their friends had a bad experience. But please remember, every group and every practice within that group has probably a different personality. So don't make judgments like that. Do your own research. Go into your own practice. Meet your own group. Ask the questions. Private practice, you may stumble on a mentor, somebody you knew, somebody who's your uncle, your father's best friend, somebody you've volunteered with, so on and so forth. Somebody you just answered an ad. But these private practices can give you the mentorship that you're looking for. One of the things we touched on back in the Dental Hamsa is what is the best way to integrate an associate into our practice? I strongly urge us as young clinicians to evaluate not only the financial aspect, the package, as they say, but look at the procedures these practices that you're interested in joining are doing. Are they referring out all molar endos? Are they referring out clear aligners? Do they even bring it up in hygiene? Are they doing all on X's? Does the doctor have a good friend that he refers out all surgery and he wants you to do the same? Or that doctor, he or she let you get educated and expand your horizons and fly to the extent you want to fly with them being a mentor in the practice? Could be phenomenal, but needs research. Needs to evaluate the aspect where you're going to live, possibly for the rest of your career. So you need to know these things. It's a beautiful office. It's beautiful technology, but they refer out every single root canal and anything that has to do with extractions. That's not what I want. Maybe the doctor will change their philosophy. Maybe that's the way to bring in an associate. This is why it's as important for you to interview the position as it is the position is interviewing you. So we've got our understanding of what our opportunities lay. We have our opportunities of knowing that we got some debt and we need to make sure we make the right move. And if we don't have debt, is that an avenue to just go and buy a practice? Or does this give me the opportunity to really get involved with understanding what I want in my career? We are looking, as we spoke in the Dental Hamsa before, in the hand, right? We are looking for a practice that we could do all the procedures. That's what I think a super generalist is about. But we need to evaluate who we are. I've broken this down into 3 categories because I've looked at myself many times in the mirror. I've looked at my clinicians that work for me. I've looked them in the eye. I look at going into his 3rd year student in my son, and I wonder, what are we? Are we a coaster, a roaster, or a rainmaker? And someone's going, what the heck does that mean? We're doing coasting or roasting? Well, I look at it as differently. I look at a doctor who goes into a practice and says, I love dentistry. I'm expecting my 3rd child. I want to stay at home, be a mother, work 3 days a week, maybe 2 would be better. I don't really have for the next 10 years the ability or the desire to go to take extra courses, extra continuing ed, spend time learning how to really treat and plan bigger cases and then be able to do them. I want to make my $200 to $300 an hour, make my $1,800, $750, $800 a day, go home, love dentistry, but my work-life balance barometer is more life than work. And my balance is skewed in that way right now. I love the fact that I went to dental school. I did a great residency. I spent a lot of time being great. Now I want to spend a lot of time balancing my life with dentistry and my family. Wonderful. That's the beauty of our profession, everybody. Pick who you are and go get it. Pick what I want and achieve it. That is a coaster. Nothing negative, may sound derogatory, but it's not meant to be. It's meant to be somebody who's going along their career and instituting everything, implementing everything they want in their life with a great career that's given them a very nice earning, a livelihood, a very nice life. My family is very happy. Maybe I'm the second, or maybe I'm an equal moneymaker in my family, but I just value that aspect more than I value to grow to be this super generalist. Fantastic. That's a great avenue. But that's somebody that looked at themselves in the mirror and said, this is who I am. Another person, another doctor will come up and look at themselves in that magic mirror and say, I don't know what I want. I don't know what procedures I love, but I know I want to be great. I want to learn, and I want to be a great producer in a great practice. That I call a roaster. Somebody who's really ready to go, ready to heat up, just not sure, needs a little mentoring, maybe needs some sort of guidance. So in the first case, let's take a coaster. I really think a dental service organization or a unique private practice could be the best. Why? Because I believe dental service organizations want dentists, like we discussed, not to be such world beaters and money makers, but really achieve great heights without doing things out of the sweet spot of general dentistry. They have guidance, but they are more of a 9-to-5 situation than anything else. Sometimes you'll find that in a private practice, looking for 2 days. So you have to evaluate that. A roaster is somebody who's right now not looking to have more life than work, but not sure which way to attack. Do I want to come in and really, I love surgery. Which way do I go? Do I incorporate molar root canals through rotary more often using certain things that I want to get trained on? That can work. The question is, which direction? Maybe I'm 2 years out of school. I went to work for a clinic. It didn't give me much opportunity. I've heard this podcast. I've heard others speak. I want to dive into something more. Well, to me, you could really run the gamut of anything you choose. It is my experience that a dental partnership organization will educate dentists quicker because their goal is to have really great general dentists in our practices. We educate them on all the aspects we talked about, but we do it through vendors, through the company's training. So it's done quickly, it's done efficiently, and it's some of the best lectures you can get. And that is for the sole purpose of understanding what we're going to do. So a coaster who's not interested may not have this as their top of their list, but somebody who's looking to become that ultimate rainmaker wants to roast along, be cooking, learn all the aspects, and then kill it once they get it all under their belt. Those are two. The last one is somebody that I always looked at myself as, and I do see a lot of young associates that have working for me that I see they have that same drive. I came out of dental school. I did a fellowship at University of Pennsylvania after I attended school there. And I really wanted to, own the world. I must give credit to a great mentor of mine, somebody who I spent a few years in his practice. I learned a lot. His name is Dr. Kenny Fishman. I want to shout him out because Kenny had a great line. He said, Dr. Mark Lighton, you want to be in practice for 5 years, 10 years? Then you need to be in practice for 10 years because the experience you learned through being in practice for those many years will never be able to be substituted. So you want to put yourself in a situation that you will attract and grow great procedures, great patients, and grow the procedures and the level of efficiency and proficiency that we are and we can deliver. To me, I was a rainmaker. I wanted to produce a lot of dentistry. I wanted to provide for my family very well, and I wanted to do great dentistry. Back then, I went into private practice, and I found that solo practices, or what I call doc in a box, did not really educate me much. I had specialists. I had a partner at the time, and we grew by learning from each other. Today, the advent of education is amazing. Every company has a whole arm of education to teach us. So you don't no longer have to be mentored by somebody. You could join a dental partnership organization like the one that acquired me and have the ability to learn and do as you're going. So your desire to be great, you will plug in the procedures that you're weak in or want to grow in, whether it be implants, root canals, surgery, cosmetics, sleep, whatever it's, that's the sixth finger, whatever it is you're looking for. These groups will provide education over the course of your working, and as long as you're increasing your production and your efficiency in your practices, they will educate you until you are great. So a rainmaker is somebody that's coming out of school, a fellowship mostly, a residency, and wants to own the world. They want to be great. They want to be a great dentist. They want to care about their patients, do quality work. I believe their best avenue is a DPO or a private practice, because the educational mentorship that's there can't be substituted. And I think that eventually it's really important to figure out the private practice you're getting into, and that you will have the ability to grow. And we touched on that during the previous episodes. These break it down into exactly what we're looking for as young dentists. A dental partnership organization for a rainmaker means the rainmaker comes in their first year, first 6 months, and I see it now, are producing between $400 and $500 an hour. They learn a procedure, root canal therapy, surgical extraction with bone graft and membrane. They're producing $650, $700 an hour. Now they're doing better cosmetics. They're instituting more clear aligners. They're producing $750 an hour. Now they're doing implants. They've gained a tremendous knowledge of education. They've been giving hands-on techniques. They're ready to embark on a great career of implants. They're doing over $1,000 an hour on a day. And if you calculate $1,000 an hour, that is producing over $1.3 million, which throws off about $400,000, $500,000, $600,000, depending on where you're working. So what I'm saying is the level of education is exactly commensurate with the amount that you can earn. The more you learn, the more you add to your armamentarium, the better you will be, the happier you will be. In my opinion, that's the work-life balance I was looking for. If I could do it over again, I probably would have been a little more life-work balance, because sometimes we get caught up in our ability to grow and be great. But I can honestly say it worked for me. I'm married for a long time, thank God. It worked. But in many instances, these things could be roadblocks to either your education or your life at home. So we always must take that work-life balance and really look at it and make sure if that's what we want, we are not impinging on that level, because dentistry is a phenomenal career. It'll give us everything we're looking for, as long as we utilize what's out there to the maximum. These groups are great. These groups are blessed for us. They provide us with education, benefits, malpractice paying, patients. We have to now learn that we are in the driver's seat. A doctor that comes in as a roaster is going to be great in a couple of years, is something that these groups would love. Not more than a rainmaker that comes in and starts producing great dentistry and has very minimal redos, and patients are just applauding the way they speak to them and love the way their chairside manner is. These are things we acquire. And as we grow, there'll be more patients, there'll be more production, and there'll be more satisfaction. So I do believe in these groups utilized the best way. If you take somebody that's fresh out, wants to coast along, maybe they get over their first 3 to 4 years. All of a sudden, they're saying, I really want to do more. Well, now I want to sign up for this course, and I want to do more extractions, and I want to do more clear aligners. This is the beauty of dentistry. Once you choose something for your first 3 years, doesn't mean you're locked in. But our ability to grow must be focused on education, mentorship, and our clinical efficiency. Those are the things that will give us the greatest production and the greatest satisfaction of being in dentistry. Must tell you, this is a phenomenal topic because the topic just can really grow in the sense that I see doctors all the time that work for me that are come out and have to be a little bit shackled, a little bit, held back because we as a group and me as the head doctor in my group, I want doctors doing the best they can do for our patients. I do not people practicing on our patients. So we do have a crawl, walk, run attitude. We want doctors to get involved. We want doctors to start gravitating towards great dentistry, learn how to develop fantastic relationships in the individual practices and subsequently with their patients. Then run. After they achieve that, gain the knowledge, gain the ability to grow and earn. But this is a process. And we say that our dental careers, and I could tell you firsthand, our dental careers are marathons. They are not sprints. What I've given you here today is an opportunity to categorize yourself, to look at yourself in the mirror and say, who am I when I come out of dental school? Do I just apply for a job? You see, then I think we'll call you a puddle jumper. You are looking for a job, and then looking for a job, and then looking for a job. And before you know it, in your town, I live in a pretty big town in New York City, you become that resume that's auto reply. We see Dr. Jones every ad. We see Dr. Smith every ad. And we say, I don't want to interview them because I see them on every single ad I place. Our goal is to pick a path, choose a lane. And whatever that lane is, know that you can always signal right or left and change that lane, but at least you have a focus. That focus, I hope, is a little bit less blurry because we break it down to 3 groups: coaster, roaster, rainmaker. And you have to pick the 3 avenues. Going to a DSO is great. A DPO will cause you to pull up your bootstraps and learn more. Be excellent. And private practice, your time is going to come when you're going to be really allowed to do whatever you want to do. But you do have that built-in mentorship, a little different attitude. A little bit about the way I chose things. When I came out of dental school, and my fellowship, I chose 2 avenues. One was working on my own in a private practice where I rented a chair. And I practiced 2 days a week, but I observed a private practice. I did not want to work in that practice. I wanted to have my own flow. I grew up in the city. I knew a lot of people. I would see a few patients a day, but I would learn from the doctor that I was paying because he was a mentor. The other side of me went to a much more fast-paced type of mall practice where I saw a lot of patients, got comfortable around the mouth, got comfortable in certain procedures. These experiences were invaluable to me. One was more high-paced, learn how to get people out of pain, learn how to take teeth out, learn how to make people look good or feel good with crown and bridge. But it was less of a relationship-driven practice and more of a production and procedure type practice. I had the other half of my week where it's so much more relationship-driven. Time to talk, time to do. Prices are higher. And it gave me the opportunity to treat and plan my cases, sit and talk to them, and really learn what it meant to treat people that are fee-for-service or patients that were fee-for-service. And I started to realize what I want in my life, what type of direction I wanted to go. It never really changes, but at the same token, I have a very fond fondness towards the groups and private practice because I believe we in dentistry provide a service to all types. So everything is valuable to us, every aspect. But this is what I did, and I think it's so valuable if you can split your week before you commit, could be wonderful, unless you find that one opportunity. If you find that one opportunity, grab it. Grab it. If you find that one doctor, that one practice, grab it. Because that would mean that you've got something that you could dig in, learn, and it is a marathon. Put those sneakers on and just enjoy. So at this aspect, at this time, I would like to say I want to thank everyone. I want to thank everyone for listening to another podcast of Dentistry Beyond the Numbers. If anybody has any interest of any topics, please send me. But we are going to continue developing young clinicians and know that we are here for the topics, digital x-rays, staff. I remember the first time I worked with the staff. We're going to touch on that. The do's and don'ts, especially this time of our lives. But remember, we as dentists are on the top of the chain. We are looked at as the high earners. Let's go out, educate ourselves, and become great. Whichever direction we go, whether it's A, B, or C, one thing is, be your best. Learn from the best and share it with yourself. Learn it from yourself and keep growing. Once again, I'm Dr. Mark Leichtung. This was exciting. Thank you so much. And remember, Dentistry Beyond the Numbers. See you there.